Hello viewers, welcome to our Facebook live session. Today we'll be discussing on knee pain, and today we have with us our specialist Dr. Siddhart Yadav, consultant, orthopedic and joint replacement surgeon at Apollo Hospitals, Navi Mumbai. He comes with over 20 years of experience in this field. Doctor, we have a lot of common questions regarding knee pain. So I am 30 years old and suffering from knee pain in both my knees while climbing stairs. So what should I do?
Good question. So knee pain on stair climbing or while getting down from the stair is very common in young age, that is around 30 years. And the common cause of this knee pain is pain in the front part of the knee under the patella bone, that is kneecap bone. So that lining of that patella bone gets softened or sometimes mild erosion. And that gives pain typically when you climb stairs, when you get down from the stairs, or when you get down from the floor or from chair. The common cause of this pain is obesity, overweight, and second is a lot of exertion, and third is nutrition. When you have prolonged dietary deficiency of vitamin D, that could lead to early cartilage erosion, and that gives a lot of pain. So what to do? First thing, we have to confirm it by consulting orthopedic surgeon, and after diagnosing it, we start certain treatment. The treatment is certain activities you have to avoid, like sitting on the floor, avoid running, avoid staircase, avoid squatting, and second thing, you should work on reducing weight. And third is we give some anti-inflammatory medication, and fourth, we give some medication for the increase your joint lubrication, or we call it for cartilage regeneration, like collagen peptide. This is the common treatment. If pain still persists, then sometime you have to analyze further. We may do your MRI scan to see how much the cartilage damage, and then we decide whether you require some lubricating injection in your knee joint. This is all about this knee pain in a younger patient.
So we have another question. I am 25 years old and suffering from pain in my right knee. I noticed a popping sound and experienced pain while dancing. So I have visited to the doctors and have painkillers and advised ice apply. So how much time will it take to heal, doctor?
So this, your typical pain happened during dance, means you are putting a lot of pressure on your knee and you had a popping sound, means something has torn in your knee or some ligament injury has happened. So in that case, I think you should get examined yourself. We'll see how your knee is stable or not stable, and if it settled down with ice application, some regular anti-inflammatory medication, then it's fine. If it persists beyond 1 week, then I would advise to undergo MRI to see which ligament is damaged, and then we'll decide about it. If it is a partial tear, partial ligament tear, that heals with time, with physiotherapy. If complete tear is there, then we have to see which ligament, whether it's an anterior cruciate ligament or meniscal injury. And as per the MRI report, we decide about it, and further treatment is decided on that report.
We have another question. I am 30 years old and have been getting pain in both my knees since past 6 months. I took steroid injections, but the pain reoccurred after few weeks. So what should I do?
Okay, so I would like to examine such patient, and further information is needed. Whether you are getting a lot of swelling, whether your knee, there both sides, the tissue is inflamed, swollen up, we call it synovitis. And then we have to work up what is the cause of your synovitis or reaction in your knee joint. Then we have to do some tests to rule out rheumatoid arthritis, to rule out other kind of inflammatory arthritis like gouty arthritis, and accordingly further treatment plan should be decided.
So my mother is 64 years old and she has knee pain. She is an independent person, but since past 1 year she is unable to walk and has also stopped her evening walks. So what should I do?
So in a 60 plus or 65 plus And knee pain is commonly due to age-related arthritis. We call it osteoarthritis. And normally in a milder form of arthritis, person can do day-to-day activities, and in moderate some pain is there, but still they can carry on their activities. But if somebody is not able to walk and pain is severe, it means the arthritis is very severe. Then we have to diagnose, confirm it by doing a standing knee X-ray. In that X-ray, if the cartilage is not there, the bones, they are touching each other and they are severely damaged, then total knee replacement may be needed. If the X-ray is not so bad, then we try some anti-inflammatory medication. We can try synovial fluid replacement therapy, that we give injection in the knee joint, lubrication, and we also give rest for a few days, few weeks, and then we see how it is. So entirely depends on the severity of the knee arthritis, mild, moderate, severe. And in an elderly patient and not able to walk, my first impression would be arthritis severe, and they may require some kind of intervention.
So we have the second last question. That's, I'm 50-year-old and suffering from rheumatoid arthritis since 7 years. Although I've taken regular meditations, but my knee hurts a lot. So now I'm unable to walk or step outside my house. So what should I do?
Rheumatoid arthritis, main treatment is by medication. We call it DMRD, disease modifying drugs. And that is the main treatment for rheumatoid arthritis. However, after taking rheumatoid medication, sometime joint damage can occur. So we have to do the X-ray, standing X-ray, see what is the condition of the joint. If joint is preserved, or we can see some space is there, cartilage is there, then maybe intra-articular injection of steroid may help. And if in the X-ray the joint is totally damaged or destroyed, then sometime joint replacement may be needed. So entirely again we have to examine, see the X-ray, see the clinically patient, and we have to decide about it.
So we come to the last question. I am 72-year-old woman suffering from severe knee pain since last 2 years. The pain has increased so much that I have stopped again stepping out of my building. I've consulted several doctors who advise me for knee replacement. I am scared of the operation. And is the operation very painful?
First of all, you should not be scared of pain, because now we are using multimodal pain management approach, and after using that, the knee replacement operation is not so painful, which was there earlier. Nowadays, patient, they don't get much pain, and in fact I would say it is almost very negligible pain, and they are very comfortable. So we use nerve block for that. We use local injection in the tissue during surgery. Our surgical technique is also modified. We preserve muscles. We don't use blood stopping tourniquet. So there are various methods we use, and end of the day, the aim is patient should not get knee pain. And because TKR, total knee replacement, if pain is not managed properly, it is a very painful surgery. But we have special program for it, and we involve anesthetist, pain management doctor, pain management nurse, and due to the entire team effort, the comfort level after TKR is very good, and recovery is also very fast. So do not worry about the pain. We'll take care of that.
Thank you, doctor, for joining this session. Dear viewers, if you have any question related to this topic, please drop your questions in the comment box and we'll address it to Dr. Siddhart Yadav. Thank you.
Thank you.